Hey, what's up everyone? This is Dr. Aaron Horschig here with Dr. Kevin Santana from SquatUniversity. Today we're going to talk to you guys about ankle mobility. Now a lot of people will have issues and stiffness in their ankles that limit their ability to perform a good depth squat. This is not only going to affect their squat, but also your weightlifting movements of the snatch and clean. So today I want to show you a simple tool that you can use to discover whether or not you have stiffness in the ankle that's affecting your ability to squat. What we're going to do is have Kevin come over to the wall, and we're going to have him kneel at a distance of 5 inches from the wall. Right here we have the tape measure, so we're going to find out that we're exactly 5 inches. From here, the goal is to be able to touch the knee to the wall at a distance of 5 inches. Now, if you can, it means that you have adequate ankle mobility. However, if you can't get your knee to touch the wall without your heel popping off the ground or your knee caving in, it means you have stiffness in the ankle that's then going to affect your squat. So, what we need to do is if you have a restriction, we need to find out why you have that restriction so that we can correct it with an effective corrective exercise. So from here, when you drive your knee over your toe, what do you feel? If you have a pinching sensation in the front of your ankle, it means that you have a joint restriction. Basically, your tibia, your lower leg bone, is not able to glide efficiently over your talus, which is one of the bones of your lower foot. So what that means is, basically a good analogy, is that if you're trying to go through an intersection that's a roundabout, your knee basically hits that roundabout. You're unable to go through the intersection and your knee has to spin off basically to get through the roundabout. So we want to clear that roundabout out. So what we're going to do is if you have that pinching sensation in the front of your ankle during this test, we need to use a joint banded mobilization to basically clear up that stiffness and help you gain that mobility back. So we're going to come over here and we're going to use the band to clear that up. Now Kevin's going to step into the band and we need to get a good amount of pressure on this. Now a lot of people will have this band up too high on the ankle. Basically what that means is it's pulling on the tibia where it should be pulling on the talus, which is that foot bone down here. So we're going to place the band a little bit lower, right over or a little bit lower than the malleolus or the bones that stick out on the side of your ankle. From here, it's pulling backwards and the knee is going to be driven forward. Now if you had that pinching sensation before in the test, that pinching sensation is probably going to be taken away now that we have that band pulling backwards on the talus. So you're going to drive the knee forward. You're going to get to the end range before your heel pops up and you're going to hold it. I want you to hold this for about 5 seconds and then slowly come back. You're going to push forward and then back. Usually I recommend people do about 20 repetitions of this, holding for about 5 seconds every single day. So let's find out what happens though if you weren't able to get your knee to the wall because you had a tightness. So let's go back here. Now not every single person has that pinching sensation in the front of their ankle. So if we go back down and we tested and you weren't able to get your knee all the way to the wall and you felt some tightness in the back of the ankle, you probably don't have a joint restriction. You may have a soft tissue restriction, which means that the muscles and the fascia in the back part of the leg, the calf, are restricted or bogged down. This is basically like a traffic jam and it's not letting your knee go all the way to the wall. So we have to treat that differently than if you had the pinching sensation. What you're going to benefit from is stretching and foam rolling. So we're going to have Kevin come over here and he's going to show you the drop ankle stretch. Now if you're in the weight room you can pile up a number of weights, but basically you want to get on something high and basically let your heel drop off the back until you feel a good stretch in the back of your calf. Now your ankle is probably going to respond a little bit better to some longer duration stretches. Usually about 30 seconds is what I tell my patients. We'll do about 5 for 30 seconds and then we'll recheck to make sure that we made some progress. Once we're done with this, we can also foam roll. So I would have Kevin lay on the ground and he's going to put his foot on the foam roller. He's then going to roll nice and slowly until he finds a spot that's maybe a little tender. He's then going to tack it down and he's going to stretch his foot up and over. A lot of people will get on the foam roller and they'll move really, really fast. That does little to affect any change in the fascia or the soft tissues that are restricted. We want to go nice and slow, just as if you were kneading bread. The more pressure you exert into this and the more pain you can cause yourself in the muscles, the better mobility work that you're going to see in the end. So no matter what corrective exercise you did, always test and then retest to see if you made progress. That way you know that the exercises that you're doing to improve your mobility are worthwhile in treating your body efficiently. So hope this is an informative video, and we'll talk to you guys next time. Thanks, guys.